Welcome to TRC, and this is we're doing a member spotlight this week, and an interview with someone who's in a very short time has contributed a great deal to TRC already, and we're just looking forward to so much more. And we have a short time of to just chat with her and hear from her about her own experiences through mental health, and in just her experiences with TRC as well, and what her aspirations and dreams are going forward, not just for her career, but in her involvement with TRC and all that she hopes and plans to do for healthcare systems in the future. So, introducing to you Dr. Nana Dansoah. She is from Ghana. I would let her introduce herself in greater detail in a little bit, but just noting that she's a medical doctor and a psychiatrist by training, and she has over a decade's clinical experience. And recently, she undertook an MSc in Global Health Management at the Imperial College London, and that's how we have been introduced to Nana, and she will elaborate a little bit more about that as well. But Nana's just passionate about just working across the healthcare system, and to try and bring a strong focus to mental health, and that just resonates so much with what TRC's heart and passion is. And so we're very happy to have Nana here, and welcome, Nana. How have you been today?
Thank you very much, Nikita. I'm great by grace, and greetings from Accra, Ghana. And really happy to be here with you. So thanks for having me.
Of course, it's a joy to have you here. And I'll ask you a little bit about if you just describe Ghana for us, for those of us who have very little idea of how it is and where exactly you are, and what it's like to be there. When you just give us a picture of what it's like to have grown up in Ghana.
Okay, so as Ghanaians would say, we love to describe ourselves as the gateway to Africa. So we are a country that's located in the western part of Africa. So we're in West Africa, and we have a population of just about 31 million. So not too many, not too large a country, but we make up for that in a huge impact. We are described as very friendly and lovable. So everyone is welcome to Ghana, and our local language will say Akwaba to welcome anyone who comes in. So it's a very tropical area. Very good weather compared to London, which is always raining. And so we have absolutely amazing weather here in Ghana. The food is great as well. So that is Ghana. And when it comes to the healthcare sector of Ghana, we do fall within the low middle income country context. So that's where we are placed. And obviously we have some pertinent challenges, but then in the midst of that, we are still thriving and trying to make some strides. So I have been active in the mental health space for a little over a decade, starting off from a junior doctor level and rising gradually to the level of a psychiatrist. And it has been very eye-opening, very rewarding, and I've found it very fulfilling as well. And I'm happy to talk more about the experience. But then during my period working from the clinical perspective, I did realize that as a clinician, I don't necessarily always drive the decisions or the kind of decisions I wanted to drive. So in terms of where funding is going, in terms of making some background decisions that determines what happens on the ground in hospitals, in clinics. And as such, the managerial aspect of it became very prominent to me as a basic necessity. As you rise up, you have to make some decisions, and you have to make them right, because those decisions have long-term effects for not just for yourself or your team, but for posterity and for generations after you. And so that's what inspired me to look into the master's program in global health management at Imperial College London. A very terrific program with very well resources and faculty. And I was just blessed to gain the Shipman Scholarship, which enabled me to have a full scholarship to pursue the program of study. And so that's what led into that program. So during my program at the Imperial College London, as my capstone project, consulting project, that's where I got the opportunity with my team to work with the George Institute of Global Health and the Resilience Collaborative, focused on healthcare worker resilience. And that had been very meaningful and very rewarding to work. And I'm really excited to talk more about that experience as well. And I think that's what led me into transition to be a member of the collaborative as well.
Yeah, that's amazing. And before we get into about your own experiences, maybe I'd like with TRC in particular, maybe I'd just request you to share with us about what it's like to so TRC has while we are a global community and we have members from around the globe, our focus is on low and middle income countries and to look at what is available in terms of resources and what can be done at systems levels in those parts of the country, parts of the world. And so I think I'd like just to ask for your experience, before you were involved with TRC or anything, but as someone who has been in the front lines as a health worker yourself, what has been your experience in terms of just facing the stress and burnout and the brunt of having to work in a low and middle income setting for yourself, but also if you have any experience of, and I'm sure you've observed it in your colleagues in I don't know, nurses, paramedics, and others who worked with you. So just share with us what that was like and what your experiences are.
It is such a good question because in my experience, I mean, repeatedly you get to see these things at play. And so coming from a background that is in mental health, which already is, compared to general health, which is already poor resource, mental health kind of just falls below the bar even further with much more deficiencies in terms of, yes, human resource, logistics, amongst others. So it is a challenging space to be working in. And there you get to see health workers working, shifts, number of shifts beyond what you'd kind of expect. And then also within the prescriber or the doctor nurse patient ratios, that's alarmingly huge. And so you would kind of sit in clinics and be seeing one patient after the other, just continuously, sometimes barely even pausing for breaks. And it does take a toll on health workers. It does take a toll on doctors, nurses. Quite often you would have a lot of as absentees, and so people would be falling unwell quite frequently, and often might not necessarily be actually would kind of in the informal ways mention that it is fatigue, is burnout, but then you never have it that written down formally as a diagnosis. That's for which reason you're getting given an excuse. So it then translates into the physical somatization aspects, and then also translates into areas of sometimes accidents, errors that are that are at play within the workspace because persons are really, really tired. And this person, their caliber of work, the quality of work they turn out. And some of the mistakes that you notice, you realize that it isn't for lack of knowledge, it's just really from them being really stressed, burnt out, and fatigued. And I think more recently, especially in Ghana, what we noticed was an increased trend of brain drain. So we started losing a lot of our nurses to European countries, UK, and other countries, seeking for greener pastures. And you really can't fault them because there are socioeconomic challenges that is our reality. But then during the period, I was working with the hospitals, leading actually the hospital's quality insurance team. And the kind of incidences that were being reported that were seen at play on our wards. And mind you, there's a psychiatric ward. So, and in the tertiary level facility. So these are clients on admission really have to be on admission. There are clients who are having the most severe forms of disorder, easily predisposed to aggression or suicidal tendencies, amongst others. And so the extent of care required is a bit more in depth. That translates to requiring more human resource being present. You need nursing staff to be present in adequate numbers. And some of these lapses with us losing a huge number of nurses within a very short space of time led to short staffing within our ward. And you could readily just link that to the kind of incidences that were happening on the ward. Sometimes staff getting physically, abused or getting hurt physically, and beyond the psychological impact, which is a bit more marked and not really overt. So in terms of the implications of this health workers' well-being, it's so apparent. It's been very glaring, and I think within our space as well, because it has been noticed, there's been some efforts to work at it. And one I can mention is, let's say, within the 2023 in Ghana, we have what we call Purple Month, which is a mental health awareness month. And during the very maiden one, there was a focal week where we're focusing on, usually would have one where it's focused on workers of different cadres. And for the very first or the maiden one, we decided to focus on healthcare workers because we realized that that was a huge area that required attention, rather than starting off with the corporates that are the typical focus for most other advocacy endeavors.
Right. Yeah. And we have noticed that it really is a cyclical issue, isn't it? You're short-staffed, and then people are pulling so much of the weight, whoever is there, and then they are burnt out. And I mean, past a point, you're just not able to pull the weight anymore. And then again, there's so much of attrition, and that's just sort of feeding into the whole problem over and over again. And yeah, and that's something you've actually seen for yourself. And so advocacy, yes, it's so pertinent to be able to make this seen, heard, and also, and hopefully it leads to impact as it reaches the right spaces. But in your experience, what has there been more that has been done for health workers? If not, do you find a gap in that space from in those settings, in the low and middle income settings? Is there more being done in the spaces? I mean, in the places that you're from. And how is your experience in that field?
I think there have been attempts at more being done.
Yeah.
The extent of the impact that I can't necessarily say with full confidence that it has yielded the ultimate outcome, because we do have problems still persisting to an extent. But I think the interventions have been from different levels. So even within teams, within groups of professionals, we try to be mindful of one another. We try to listen a bit more. We try to look out for one another, so that when you notice someone is not too well, you're asking the right questions, and trying to also let people have some time off. So sometimes it's a bit informal, so that people can have the space to recuperate. So that's within the team level. That's happened. I know within doctors associations, nurses associations as well, these conversations have been happening, trying to rally resources to support members. But then also within the organization, there had been some efforts. But I think that the challenge is when you're working in very challenging environments where you know the resources, you know the solutions, but then the finances to support some of the interventions that are really nicely written on paper aren't there, then that's where there's a gap. So sometimes it ends up being a lot of lip service, or there's a lot of, here we have a term, we say it's in the pipeline, it's being worked on, but then most people say that the end of that pipeline never gets seen, So consistently, as with quality improvements, one of the complaints we constantly hear about is inadequate resources to work with. Staff will say they don't have the tools they need to work with. And yes, there's some correction, there's some solutions, some are being solved, but it's never all at the same time. So it seems like there's nothing really being done, because once one is fixed, there's a new gap. So it always feels like you're fetching water through a basket, essentially. So that tends to be some of the picture. Policy-wise, I think on paper we do have quite a lot of them already in there, but just the extent of implementation. Funding has to mental health has consistently been below the recommended 5%. We've been looking at 1.5 to generally, and that's been the trend. And now with current global issues, if you're considering even aid, and most LMICs are dependent on donors, foreign aid.
Yes, of course.
And now that sector too has immense shakings. So that has led to a lot being very unstable grounds, I should say. There's not much you can say tentatively has, like, finally this is the full outcome. I think that's what has led to the perpetuation of the issue. So, so then to a large extent, most end up resorting to self-care within teams, within organizations, while then at the main system or main policy level, we haven't seen as much push as we would love.
Of course. So can you tell us a little bit more about how you came to be involved with TRC? You mentioned your program with Imperial College, but yeah, can you let us know a little bit more about why TRC resonated with you, and why you chose to do that, and also what your experience has been, sort of. Nana has been working quite intensively with her team on the theory of change that we're developing right now, and so yeah, I'd like Nana to elaborate on that.
So thanks for that. And my interaction with TRC is, as I mentioned earlier, started by the Capstone project, and getting towards the end of the program teams recommended a number of topics, and jumping up to my team and I was the topic on the healthcare worker resilience pathways for that improvement. And looking at our backgrounds, myself, another doctor from Indonesia, two neuroscientists, one from Nigeria, the other from India, and then one with a pharmacology background from India, we're all in some form of way health workers, and from LMIT context. So it just resonated so much with us. And I was a bit biased as well, coming from the well-being mental health aspect. And so we did bid for the project, and some other teams also bid. And we're particularly excited that the TRC team picked our team to work on this project. So that's how we engaged. My engagement commenced, and I think what I loved about it was the fact that this project essentially was focused on pathways to improve healthcare worker resilience. Understanding that yes, health workers have shown that they do imbibe some level of resilience already.
Of course.
But then we're looking at how to build on this and how to translate this to even greater resilience. And it drew on so much of what we've learned, what I had learned, which was really non-clinical, bringing all the other acumen from business perspectives to their analytical perspectives. And that's what I loved about it, because it drew 9 models, starting from root cause analysis, going into the theory of change, as you rightly mentioned, and using some other technical analysis like Combi lens, and doing some impacts, feasibility analysis, doing behavioral journey map. So it was a lot of work that I loved. And we try to incorporate as much as possible to also ensure that it is relevant, it does resonate with what is happening on the ground and with what we experience in our various settings. And that's what we did. And what I actually love about it as well is the fact that we got to do the preliminary testing of this. So it wasn't a full we couldn't do the necessarily do the full impact of it, but then we did start a preliminary testing, which gave us some initial feedback from healthcare workers across different jurisdictions, and it was really gratifying to see some of the themes that we had brought in from literature, and also noticed from our experiences and discussions with the TRC team, who were immensely helpful, seeing some initial feedback coming in and just letting you know that we're on the right track, but then just need a bit more to be built on that to ensure that it does yield the outcomes for. So that's essentially what we did.
It's to hear that, and there have been so many times that discussion has come up that the answer to this possibly lies in an integration of so many different fields, and just to sort of use, and then I think that's why it helps to be a community of practicing. We have the space to bring in people from who have seen it from different angles, and it's great to have people like yourself who sort of who are growing into this field, and hopefully the future of health systems is in the hands of some of the people here who are putting in the effort to sort of drive this change from ground up, and even and helping us to even to work through how we want to work towards change, not just on individual levels, but on systems levels and in the community as well. So yes, it's just so great to hear you sort of resonate with that. And but I just want to I think I want to hear from you. What would you, in your experience or in your observation, are the best ways to, and you mentioned that you want just the idea of building resilience is something that resonated with you, right? And of course, healthcare workers are probably the most resilient people, which is why we have so many health systems running today, given the pandemic and all the hits that they've taken and still running, um, and that's purely because of the resilience of healthcare workers. That's just so naturally in that they have sort of inbuilt into the system
Mhm.
themselves to sort of survive what they're going through. But what, according to you, or in your experience, has been a way to sort of build resilience? And you're from a mental health background, so I think you'd understand what that takes, and that resilience is not just about, oh, I take a hit, I bounce back, but there's so much more into working towards it from even before you've taken that hit. So what are in your experience some ways to sort of, for a person or a team to sort of start working on resilience? And we have a lot of healthcare workers who are watching this and hopefully watching this. And I hope it helps even from your perspective, and from if you've seen it in your culture, if you've seen it in your space, then to take that and apply it in other spaces. So share with us what you think might be some ways to sort of help strengthen resilience.
I think that's a really important question, actually. So for me, I think for my maybe leanings from my experience and my training as well, quite often when the system is failing, you kind of have to start from within yourself as an individual, and then you kind of work out, still aiming at the system being corrected and being fixed gradually. And personally, I think it boils down to the basic things of self care. You know, we keep saying it. It sounds so basic. It sounds so
Yeah,
easy, but
of
then
course.
when in the space, you realize that it isn't at all. It is. It takes a lot of intention to maintain
Mhm.
some routines that are actually healthy. So taking good care of yourself, eating well, sleeping well, getting the adequate rest. Um, and so, before my masters, I just realized how terrible my schedule was beginning to look, because well then now with the advent of online meetings amongst others, we would then now spread meetings across right into 7 8 p.m.
Mhm.
even when you're out of office. So that was kind of
Right, right.
tipping the balance into an unhealthy space. And so sometimes having to draw yourself to intentionally cutting off
Of
some
course.
of these
Yeah,
so that
yeah.
you are balancing work responsibilities in a very healthy manner.
Mhm.
And then you talk about sleep, you talk about meals, um, adequate healthy coping mechanisms. We talk about it in the healthcare worker, but sometimes you see someone practicing what they're not preaching. So
Mhm.
using unhealthy mechanisms like use of substances,
Mhm.
among others. And we've seen that happen within healthcare space
Of
as
course.
well,
Yeah, yeah.
because there's access to
It
some of
is.
these in
Correct.
there. Um, and then one key thing was also being able to talk
Mhm.
about the experience and what we're happening, what we are experiencing. Um, so that happens. But what I appreciate is being able to also do that out of the hospital setting. So within teams, yes, you're able to discuss some of these things and then bring up what you're feeling internally. So that's psychological safety within teams really does help,
Mhm.
such that what I noticed with where our feedback surveys was that in as much as some teams or some staff didn't have so much, maybe would express not having so much faith or faith in the organization to address some of their
Mhm.
challenges, they had
Yeah.
immense faith within their team and their
Mhm.
colleagues and the
Mhm.
leadership within their units or wards or wherever they were. So that network
Mhm.
within their spaces was kind of what's holding them and keeping them together. And so
Right.
building those, having that psychological safety to talk about the things that negatively impact us was really important, and being able to actually even debrief so that you handle if you've handled something difficult, you should be able to come back and just be able to be actively engaged to speak about what the experience meant and how it's making you feel and all of that. So that having that space to debrief and get these off one's chest, out of one's system is really important. But then beyond doing it within the hospital or the clinical setting, being able to do that out of that setting is also helpful. I think that for me has been immensely useful. Fortunately, I have family that I'm able to share some of my frustrations
Yeah, yeah.
with. And sometimes just saying it out loud just so that it's not in them. You're not expecting answers or solutions,
Correct.
but just a hearing ear. That's not professional. Just speak it out. And I think one of the time the highest or their immediate go-to approach was actually more of family faith rather than professional help. And that seems to be a trend that was noticed, and it did resonate because that is what it is for me as well. So faith does play a huge role for me, and I think for people who are of faith, it does really help. And if not, then techniques like mindfulness techniques and others, be able to relax, getting yourself out, being in the present, still helps. So that I think that number of techniques or these interventions that are done within the individual team levels that are useful. But then, as said, it still requires that the actual root causes are
of course.
the extent to which you continue having these as efficacious in this pending repeated challenges can dwindle with time if no change is really being implemented to address the main issues.
Yeah, and that's so well put. Thank you so much for that, Nana. And that makes so much sense to have a support system, right? To whether it's your team, it's your family, it's your community in some sense. It's just to have that safety net, like you said, and that's beautiful. And because as a health worker here, who might be listening to this, it's not just that I could care for myself, but I could be that support system, and we could do that for one another, and how we can start building that. But of course, we want to work towards changes on higher levels and to address those root causes. But this really will start helping work towards to greater resilience. So yeah, thank you for that. That's beautiful. Um, I think something else that we'd like to hear your thoughts on. What are your aspirations going forward from here? You've just completed your course with Imperial. You're back home in Ghana. So share with us where do you see yourself headed from here, um, and hopefully as TRC we can plug in into that and be and sort of journey with you through this and be supporting of you through this journey as well. But we'd love to hear what it is you see coming in your future. Yeah.
That's such a huge and such a big question.
I know.
Yeah, but then I mean, it is a big question because I think the year at Imperial was really enlightening for me. For most of the programs or the courses I would sit through, as we're discussing various topics, I keep getting glimpses of what I would want to use that for going forward. That I end up with a very long list, and it's like just trying to see how all of that can actually fit into making sense as time lapses. But I think coming back home, the major thing is trying to one, not lose touch of clinical work, not lose touch of being engaged with patients at some level, because that keeps you grounded, I think, so that I don't just lose touch of the actual problems on the ground. So maintaining that as much as possible to the degree that I can, but then also looking at making more meaningful impact from policy-wise, and not just writing or drafting, but then in terms of developing project programs that are geared towards making the change that I'm seeking to do or achieve. Now there's a lot. I think one of the things I got from Imperial was really a drive towards innovation, trying to be innovative, trying to and this has always actually been there, but I think it's just from a different perspective of a greater push towards being innovative, appreciating what we have, looking towards frugal innovations, what we already have existing that is within our reach, and see how we can bring that up, amplify its impact. So incorporating more advanced technologies as well. So trying to leverage and so that we are not necessarily left behind, but also making the most use of what we have, our strengths as well, and bringing that to the fore. So it's a lot of thinking, it's a lot of brainstorming right now. But I am excited about the future, and I'm looking towards working on a lot of projects and programs that are still within, yes, mental health, but more broadly into the NCD space as well, non-communicable disease space as well. Because I realize that sometimes if we isolate mental health as just mental health, and not necessarily tie it in with all the other things that are happening, it makes it look, it can isolate it in a way that is not too beneficial. So tying it in with all of the other nuances that are happening in the space, so that it's well put together. And I think now for us here, the aim, and I think it is still global, the aim is to decentralize mental health, get it within communities, like, demystify it, and get it really integrated with every other form of care. So that's what we're looking at doing. So I am excited. I'm hoping to still not just be local. My program is global mental health, so I'm really looking to having global partnerships, making global impact, because the problems we face here actually replicates itself in different settings as well. And sometimes learnings from these different settings can actually help us get adequate and more lasting solutions. So partnering with TRC and with other organizations, and thinking through with colleagues from different backgrounds, and just bringing our different experiences together and pushing towards greater agendas is what I'm looking at. So I'm very open, still eager to learn, and I'm just excited to make more impact. So that is my plan, which is very vague going
But
forward.
such big, beautiful dreams. Loving that. That's nice. But I mean, we know it's just 1 week into your break from Imperial College, so no expectations for you to have figured it all out. But it's great to hear what you see coming and what you want to work towards. Just it's so beautiful how you want to integrate what you have in your culture, in your space, in your country, but also to try and bring in technology and other things that might work with that to make the whole thing a bit more efficient. So, so wonderful to hear all of that. So, I think we can wind up this interview. It's so nice to have heard your experience, and it's such an honor to have you here at TRC, and I think we're just so grateful to the Imperial College team for having worked on the TOC with us, and just to build it up, and to integrate so many of these other wonderful new ideas into it. But as we just sort of sign off, I think I just ask you if there are healthcare workers that are tuning in and watching this, and if there is just a positive encouragement, something that you'd want to leave with them as we sign off, then I'd let you do that. And thanks again, Nana, for this time with us, and we really look forward as TRC to what we could do together.
Thanks so much for having me. It's been an immense pleasure, and I'm looking forward to greater work, or even more work with and partnership with TRC. And for healthcare workers, I just want to say I can understand the frustration sometimes. I can understand it is understandable, and having any negative or down feeling, it's okay to feel them. I think the important thing is identifying it, knowing what it is, and calling it what it is, and where needed to reach out for help, you do. Taking care of yourself is immensely important. I mean, the saying is, and it is true, that you can't pour from an empty cup. The truth is, you really do have to take care of yourself. Your well-being matters, and that's where you're able to be more efficient and impactful towards others. So you're doing great wherever you are. You're strong, you're bold, and but when it is time to take good care of yourself, please do. And when it's time to reach out for help, help is available. Do reach out as well, because we are humans after all. So take good care of yourself and stay in touch. And wish you the very, very best. I
Oh,
think those
thank
are
you so
mine.
much, Nana. That was so beautiful. Thank you.